I'm deeply grateful to the meeting organizer for the kind invitation and give me the chance to share experience from China. Okay. I just introduce briefly the China's briefly the drug prevention and treatment and the main policy and the measure for the drug-dependent treatment. In history, China had been suffered from the scourge from the opiate abuse for almost 200 years. In 1949, the total number of opiate abuse was estimated some 20 million, account for 4.4% of total population. On February 1950, the government of People's Republic of China launched a drug control company. The cultivation of poppies, the manufacture, traffic, and treat of opiates was strictly forbidden. Drug offender was seriously penalized, and drug addicts were sent to the special treatment center for detoxification and rehabilitation. By those effective steps, the drug problem was virtually wiped out in the country by the end of 1952. After that, the Chinese people avoid opiate scourge for more than 30 years. However, from the beginning of 1980s, drug abuse became a global problem, jeopardizing almost all the part of the world. Influenced by this situation and the drug transit from a golden triangle, the one of the biggest sources of drug in the world, ignited the emergency of drug abuse in China. According to the national scale drug abuse survey and statistics of National Narcotic Control Commission, the number of registered drug abusers has been increased from the 70,000 in 1990 to 3.23 million by the end of June this year in mainland of China. The drug abuser population, including drug addicts, recreational users, regular users, and initial users. However, the actual number of drug users is much higher than those who are registered. The estimated number of drug users is as high as 14 million. The problem of drug abuse has spread in 3,000 counties and cities. In other words, it has been involved 90% of region of China. Figure 1 shows the increased number of registered number of drug users from the 1990. Compared with 1990, the drug users increased 40 times by now. The second part is this category of abused drugs. Heroin is still one of the major abused substances in China. However, the epidemic of scores and regions of heroin abuse has been kept in limited. Those of drug users using heroin decline gradually and make up about 49.7% of the drug users' population by the end of this year, end of June this year. This is the registered heroin users in the last decade. the heroin users decrease from the about 19% to the 46% this year. Polydrug users is common among the heroin addicts. Drug used in combination with heroin, included sedative hypnotics such as benzodiazepine, painkiller such as tramadol. Some heroin addicts mixed with opiate and amphetamine type stimulants or other new type drugs such as ketamine. Aside from the opiates, drugs such as methamphetamine and ecstasy and ketamine, which was called the new emerging synthetic drugs, spread quickly during the past decade. MDMA and other ATS emerging as a new type drug in China in 1997, and ketamine emerged in 2000. It has been rising quickly in recent years. The population of new type drugs used among the registered drug users increased from the 6.7% in 2005 to 52% by the end of June this year. This is a new type of drug registered from the 6.7% in 2005, increasing 52% this year. This is a trend of the heroin users and the new types drug users. We found that in the last year, reached the cross, and new type drugs increasing quickly, and heroin abuses continue to decrease. ATS abuse was fairly common in some public entertainment in some middle-sized and large cities, and show the trend of spread from the urban to the rural areas, and most users are unemployed and self-employed with middle school education level. However, this alarming situation is that drug users spread in young people and all circles of the society. Those abuse new type drugs come from all the circle of the society. According to our survey, certain social states, such as white-collar people, government employee, and staff has been penetrated. The misunderstanding and poor knowledge about new synthetic drugs is a main reason of initial or child use. Our study indicated a new type of drugs abuse produce multiple social, public health, and individual consequences. Main policy and measure of drug treatment and harm reduction. The Chinese government attached great importance to drug control and drug abuse prevention. A series of principal policy and measure in drug control prevention and treatment have taken. The policy support and promote multiple way and comprehensive treatment of detoxification and rehabilitation for drug users and relapse prevention after detoxification. The principle of drug control in China is putting prevention first, comprehensive management, and drug control. And four burns, illegal cultivation, manufacture, trafficking, and drug users. The principle of detoxification and rehabilitation for drug dependence. This people-oriented, based on the community detoxification agent and the rehabilitation center. Community mobilization takes various measures to help drug users to overcome the drug dependence and helps them to care their addiction and prevention and reduction of the relapse. The model of treatment for drug users. The government plays a leading role in the treatment of detoxification and rehabilitation. 4 kinds of treatment are the comprehensive detoxification. This is 1 or 2 years. Volunteer detoxification. This model is 3 weeks to 2 months. And community-based detoxification and rehabilitation is 2 years. And community-based methadone maintenance treatment, this 6 months is at least. The main pharmacotherapy of treatment for the opiates addicts. We can got methadone for detoxification and maintenance. Second pharmacotherapy is buprenorphine and Suboxone. Buprenorphine sublingual for the detoxification have market, but the Suboxone for the detoxification and maintenance in China, we just in the clinical trial, phase 2. And traditional Chinese medicine, there are 10 kinds of herbal medicine have market. The main strategy of the harm reduction, including MMT and the needle exchange program. By the time of October this year, the cumulative number of treated patients reached 200,000 in 770 clinical sites in 27 province autonomous regions and municipalities, the cities. Main dose of level from 35 milligram in the Ningxia province to 77 milligram. This is the Yunnan province in different regions. This is a structure of the MMT program. It's a national working group, and the blue one is province MMT working group, and the yellow one is counties MMT working group. This is the MMT site. The measures, strategy, and intervention of harm reduction show the positive effect in HIV/AIDS prevention and transmission among heroin users. The challenge is we faced. The one is the prevention of new emerging synthetic drugs abuse in young people, such as methamphetamine, MDMA, and ketamine. The prevention in young people. The second one is the pharmacotherapy for the new type of drugs for the methamphetamine and the ketamine in those of the drug addicts. Hopefully, the potential of the pharmacotherapy this morning introduced the abroad market quickly. Okay, thank you very much.